circulation. Fetal circulation is a system in which the fetus in the uterus gets its nutrients and oxygen through the placenta from the mother. So, in this procedure, we have 5 structures that are temporal, which are umbilical vein. We have a ductus venosus, foramen ovale, ductus arteriosus, and the hypogastric arteries. So the blood coming, the umbilical vein carries blood from the placenta, oxygenated blood from the placenta to underside of the liver and supply the liver. Then the umbilical vein will now join with the inferior vena cava, forming what is known as ductus venosus. And from there, we push the blood into the right atrium. And in this right atrium, the blood will now bypass the lungs by passing through foramen ovale to the left atrium. And from there, the blood will now go to the left ventricle and be pushed to the aorta. Then the blood will now supply the upper part of the body. And this is the reason the upper part of the body is broader than the lower part of the body, because the blood is highly oxygenated. So now, blood from the upper part of the body will now pass through the superior vena cava into the right atrium. And due to contraction and pressure, it will now come down to right ventricle. And from the right ventricle, it will be pushed through the pulmonary artery. Part of the blood, some percentage of the blood will now go to the lungs for oxygenation and the nutrients. Then the major part of the blood will now, the artery will be bifurcated. The blood will now go to the aorta, that is from pulmonary artery to the aorta. Then from there, it will now go down and supply the lower part of the body down to the descending aorta, then to the hypogastric arteries, which will now join the cord and become obliterated, join the cord, and carries deoxygenated blood back to the placenta. Thank you.